Healthy heart is most desirable for us. Heart beats to circulate blood and oxygen around our body. The heart and blood vessels together form the cardiovascular system. The components of blood are plasma, white blood cells, red blood cells, and platelet. WBC helps in making barrier against infection and other diseases inside our body. RBC transport oxygen throughout our body from the lungs and also carries carbon dioxide back to the lungs for exhalation. Platelets travel to the injured site to form a clot which can help to cease bleeding. In smooth states, they circulate easily in blood stain and wave pattern. As blood moves, it pushes against the sides of the blood vessels. The strength of pushing is blood pressure. In healthy heart, blood vessels can stretch to allow the blood flow normally to keep the blood pressure normal. Platelets are such an important component of blood to play a significant role in clotting blood at the site of vessel injury by functional aggregation. The platelet aggregation is crucial body mechanism in hemostasis. The first step of platelet aggregation is platelet activation, in which situation the shape of the platelet changes from its normal resting position to dendritic form. Activated platelets influence the process of platelet adhesion at the site of injury to induce the activated platelets to form pseudopods for helping them binding with each other. This mechanism helps in platelet aggregation to form a plug or clot. Since initial platelet activation, platelet adherence triggers a series of biochemical events leading to platelet aggregation, where multiple platelets clump together to form a clot or plug for sealing the damaged blood vessel. Though platelet aggregation is a tightly regulated process, sometimes dysregulated or excessive platelet activation and aggregation can cause several cardiovascular problems and thrombotic disorders. The hyperactivation of circulatory platelets insists the process of atherosclerosis or plaque formation in blood vessel, which can block the blood flow in arteries and cut the oxygen supply. Damaged blood vessels can increase blood pressure as they are less stretchy to allow normal blood flow. The abnormal platelet aggregation exercises raise blood pressure to put extra strain on blood vessels, and the sudden burst of the plaque followed by a blood clot can heighten the risk of heart attack. Several risk factors like high cholesterol, high sugar, high blood pressure, obesity, smoking, stress, an inactive lifestyle, high-fat diets, insulin resistance, and moreover pollution can enhance the risk of heart disease. Some antiplatelet drugs like aspirin, clopidogrel are available in market to stop platelet aggregation, but they are unsuitable for vulnerable people. Potent antiplatelet factors are found in kiwi fruit extract, KFE, which significantly can reduce platelet aggregation, as well as lower blood pressure inside blood vessels. The India-born American scientist and Nobel panelist Dr. Asim Kanthi Duttaroy invented miraculous internationally patented KFE, which has 7 human trials published in several international journals.
Heartifine contains patented and clinically proven extract, specially isolated from kiwi fruit, and also it contains L-arginine. And these ingredients effectively check blood platelet hyperactivity and hypertension, that is high blood pressure. Platelet hyperactivity is a critical factor for the atherosclerosis processes, the part of the cardiovascular disease, and also the final events of heart diseases. Therefore, platelet hyperactivity and high blood pressure must be taken care of. Regularly consuming this newly developed Heartifine increases the blood flow by normalizing platelet hyperactivity and maintains blood pressure despite someone having a sedentary lifestyle, bad diet, stress, smoking, obesity, aging, etc. So anybody can take Heartifine on a regular basis as it helps maintain a healthy cardiovascular system.